All right, so here we have a punch biopsy of skin, and you can see a pretty moderate perivascular lymphohistiocytic infiltrate here. The epidermis looks mildly spongiotic, and there's a good amount of, I'd say, interstitial edema as well. You can see a little bit more moderate perivascular inflammation here, and if you scroll around, there are some scattered eosinophils within the interstitium as well. But interestingly, in this specimen, we also have something over here to the adjacent peripheral side of the skin. Here you can see what appear to be tick parts. And so this looks like the mouth part of a tick embedded in the actual dermis here. And you can see a really nice overlying connection of the tick in the body, the inner part of the organs of the tick as well. So this is actually a tick bite that we biopsied off the patient. And then here is a little bit residual of tick part mouth here. And then over here, just to show you the actual tick body. So you can see this kind of exoskeleton. It's very well organized. And the inner parts of the tick actually look consistent with what we saw close to the mouth part that was embedded into the dermis too. This was about halfway into the patient, so we definitely needed to remove it surgically, or else we were going to risk leaving behind those mouth parts and getting a granuloma. So that initial biopsy section here was bisected, and we were able to see the tick mouth and the dermis there. But overall, the rest of the specimen actually looked free of the tick. So we believe that we got it fully removed here. This looks to be a little bit of a floater tick part. So definitely could test you on this. So just be able to recognize the mouth part of the tick and be able to select the right answer. Usually they'll show you just these portions of the tick mouth, and they'll expect you to get it right, that it is a tick by itself. And just one more view. So they may show you something like this and expect you to make the diagnosis of a tick or mouth parts of a tick just with this here. So review a couple of examples of these. Now I can't tell you exactly what type of tick it was here. Obviously that's for another lecture, but just be able to recognize a tick on histopathology.